Hi everybody, so welcome back to our weekly vlog, and today I'm going to talk about just what we use fillers for. What do they do, what do we use them for, and where do we use them? Because people often don't understand the difference between fillers and wrinkle relaxing injections and think that they can do the same thing, and they can't. So just to clarify from the start, fillers are solid products, gels, which are injected into the skin, under the skin, and they lift. So that is essentially their mode of action. They lift. They fill a hole, they fill a line by lifting it. So that's the main action. Whereas obviously a wrinkle relaxing injection paralyses muscle. So for example, these lines here, fillers are not going to do much for those because they're happening when I move, but Botox will. So I do need to go and do it or get it done. Okay, so fillers. So there are lots and lots and lots of things we can do with fillers. They're a really exciting product because outside of the standard things that people know, you can do almost anything with a filler. You just need to be a skilled practitioner and know what to use, why you're doing it, and where to put it. So that's the most important thing, because when we're injecting, we need to avoid, obviously, what's going on under the skin. So we don't want to be putting filler into arteries or lymph vessels or anything. So if you've got a good practitioner who's medically trained, who knows where to put things, then you're onto a winner to start with. So let's start thinking about the face. So you may not think I need fillers, but I do. I don't need them, but I want them. I've never had them before. I'm 53 and I think it's time. And so I've had an assessment with another practitioner because I would never think about doing fillers to myself. It's just too difficult. You need somebody to be artistic about it. And I always say to the patient, which is what the practitioner said to me, what is it that's bothering you? Because any practitioner could look at you and say, oh, I would do this, 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 this. But actually, what you want to know is, what is it that's bothering the patient, and then can you do anything about it? And that's always my approach. We don't start with me, we start with you. So what's bothering me is this area here. And just feeling that my face, I'm a runner, my face is all feeling a little bit, hang-doggy. Now, it's not massive. I think my skin texture is changing as I get older. So this is what's been recommended for me, and then we're going to talk about other things that I would do for other people. So firstly, as you can see, my temples here are pretty sunk in, and this is often something that we see on people that are thin, and I am quite thin, and often if they're runners, because obviously gravity works. So the first thing that I would do for someone like me is put some filler here. It's really easy, it's really safe, and it's really quick. And just lifting out these areas can make an amazing difference. So those are called your temples, so filling your temple area, number one. And that just helps everything lift a little bit as well. Then this area is really hard, but quite often what you want to do is you want to actually just replace volume here. So you can use fillers in the mid-face, this is called the mid-face, to just put back the volume that is slowly going down, and it is going down. That's what happens to all of us without a shadow of a doubt, and it increases these. So just by putting filler in the mid-cheek here and lifting up, you can improve these lines and some of these here, and that in itself is enough to just take away that dragging down feeling which some of us get as we get older. It's almost like that painting the screen. Quite often people are worried about this area here, the tear trough. Now, tear troughs are a specialist area to treat. I do treat them. You must only have someone treat it with a cannula to be safe. But quite often, just by replacing here some of the volume which has gone down, that is enough to support the tear trough underneath without having to go into that more dangerous area. So with a patient who comes to me about these solely, I will quite often look at them and say, well, do you know what? If we just support the area under the tear trough, not directly in it, that will improve it, and it does. Thereafter, we can go into the tear trough if we need to. So far we've got temples, cheeks, mid-face, tear trough. Really, really great stuff, fillers. You can do so much. Some people don't have any of this aging process go on, and they want better, more defined cheekbones. That's really easy. We go in from here and we just lay the filler down along that bone here, and it works beautifully. So we can give you more defined cheekbones. We can give you apple cheeks if that's what you want, and some people do. Just literally by going down onto the bone and placing the filler there and lifting the cheeks out. So we can really reshape the mid-face really quite easily. People will need more or less filler. That's not always predictable because it depends how deep you are to the bone, how much space has been created, how young you are, how old you are. So people will need different amounts of filler. That's not so predictable until you're examined by the practitioner. Now, some people worry over time that their jawline is just disintegrating as it all moves, and we can actually put filler all the way along your jawline to actually just redefine that for you, to give you that nice angle if it's disappeared or if you never had it. So we can build up things that weren't there, but in the main we try and replace what you're losing rather than create you new things, but it can be done. Noses. Noses are fabulous to treat with filler. I love doing noses because I find them quite straightforward, and also the more satisfying thing is that whatever the patient asks for, I can usually achieve, and if I can't, I won't do it. But that's rare with noses. So what can we do with noses? We can build a bridge, so you get some people, especially from certain nationalities, who don't have any bridge at all. So we can actually build that up. That's really easy. We can certainly straighten bumps, so you know when people have a bump here, we just put filler above and below it and straighten it out. People worry with noses that putting fillers in will make the nose look bigger. It doesn't, weirdly enough. When you take away the defect, they actually look smaller. And I've done it so many times, I feel really confident in saying that. Some people have a downward turning tip of their nose and they want that lifted. Well, just putting some filler up here can lift it. We can actually put filler in the tip carefully and lift it, and we can even sometimes use wrinkle relaxing injections in here to lift it. So there's lots of things that can be done about the tip. Some people that have had an injury have a crooked nose, and so you can actually see the bone and the stress. We can actually straighten that up because we can put filler in the defects either side of it, and that works really, really well. Some people have a real hook nose, and that really bothers them, and that's quite simple as well. We literally just put filler up here to just soften out the hook, and it completely changes the rest of the nose. You can see examples of this on my Instagram where we've done exactly that. So noses are absolutely brilliant. Lips, obviously lips we do all of the time. Can do it in two ways, can do it without an anaesthetic, with an anaesthetic. Some people want an anaesthetic but you are completely numb for about 3 hours and a bit dribbly. Other people can cope with it and it's fine. I would say more often than not we do it without anaesthetic because people don't want that, but I'm happy to work either way. Lips can bruise terribly because they're quite vascular and they do swell, so you do need some downtime, but we'll talk about that with procedures. But lips can be softened, just a soft filling all the way through. We can outline the edges of lips, so for older women that works really well to get rid of the little lines that you see above the lips, especially they're called smoker's lines even if you haven't smoked. That's really easy to do, quite straightforward, and really makes a difference, really makes a difference. Obviously volume as people want it, and trying to define the cupid's bow can also be done, but obviously we can't on lips make a cupid's bow if there was never one there. Balancing the lip size out is something that we do lots. Okay, chins. Oh, chins make such a difference. So I've actually had people who have had no chin, it's almost straight down to their neck, and just using 1 to 2 mils of filler in the chin to build a chin completely changes the profile. It's really easy, it's really quick, and really quite safe in terms of filler areas. So chins make a major difference to your profile and your lips and your nose. So that's another really good one to do. Fine lines. So fine lines around the mouth, around here if they become permanent rather than just when you move. Skin boosters are really good for that. So that's what I'm going to be having done. I'm going to be having done my temples, forgot the name then, and I'm going to have skin boosters all over, 3 sessions. And so basically skin boosters are a very, very light filler. They don't really lift out very much, although they have quite a thick density or a prime, but we'll talk about that in another vlog. So they sit under the skin, they attract water, they rehydrate, and they're really good for skin texture. I use them all of the time for acne scars. So let's talk about acne scars. So acne scars are so stigmatising, and I see patients who have been through hell trying to get rid of them over the years, and the best results we get are with fillers. So for most scars I use skin boosters. It works really, really well, 3 sessions, not too painful. You do need some downtime because you have lots of little injections, but it's worth it, and you can cover it the next day. Or normal fillers, and I use something light like Restylane, putting it under the acne scars and lifting them out. And I honestly have had people who have spent £10,000 on lasers to no effect have brilliant results with skin boosters or fillers, skin boosters or other fillers. So acne scars as well. What else do we do with fillers? So many things. Hands. Backs of hands, when they're old like mine, although mine have looked like that since I was 10, I think. Just putting a filler inside there, something nice and soft, even from the Juvederm range, you know, something like Vobella. Attracts water, lifts it out, takes away all the ligament, you know, really sticking out in the veins. You do it with a cannula, so it's nice and safe. I've done this for my mum, and it's a really, really lovely treatment. Décolletage. So a lot of women as they get older find they get lots of little creasy lines there that they really feel are unattractive, and they can be treated nicely with skin boosters again. So lots of little injections under here. 3, we normally do 3 a month apart, and then you only need to have a top up once a year. That works beautifully for there. And the neck, having some fabulous results with skin boosters or Profilo. Talk about that in a second. On the neck. So Profilo is another product very similar to the skin boosters that sits under the skin, attracts water, and gives you some skin resurfacing. So lots of little injections there to just improve that skin on the neck. But something else that I've recently started doing on the neck, I've had some younger people who have some really fixed lines, just 3 of them, for example, but nothing makes them go away. They're not overweight, they're not old, they've not got poor skin quality. It's just the way that they're built. It's one of those things. And I've actually, with a cannula, been putting filler directly underneath those lines with some fantastic results. Again, I think there's examples of this over on my Instagram at Non-Surgical Clinic, so have a look. So we've got the neck covered, we've got the décolletage, the backs of the hands, but I've even used fillers, for example, on legs, on a scar. So somebody had a traumatic scar where something flew into their leg and caused a long-term dent about that big, and I've actually used filler in there to lift it out. So you need a fair amount of volume, but it works really, really nicely. And whilst we're still on the subject of scars, not acne scars, other scars, I've done lots of work on people that have got burns or injury scars. So I've got hay fever, excuse me. So here, for example, I think this is on the website with some oil that splashed into somebody's face and left a really dented scar. So whilst we can't improve the actual scar, what we were able to do, what I was able to do, was lift that scar out. So the skin was in line with the normal skin. And that in itself makes a major difference. It doesn't attract the eye so much. Done quite a few of those, and they're on the Instagram account. So again, really flexible, and just using your skill as a practitioner to tackle something that is a bit outside of the box. And then what else? We can use filler to turn the corners of the mouth up, so you're no longer got that sad mouth. We can actually use it to lift the corners of your eyebrow by just putting a bit of extra volume there. So the list of things that we can do with fillers is endless. You just need the right practitioner who's skilled, who's done it lots of times, who knows the underlying anatomy, who knows how to handle complications, and we're going to do a vlog on complications, and can show you pictures of the work that they've done and tell you how many they've done, because that's really important. So don't just think fillers, lips, big chipmunk cheeks or things like that. It's not like that. They're versatile. They can really, really achieve amazing things. And if you've got a question, ask, can it be done with a filler? Because sometimes we haven't really done it very often or hadn't thought about it. And the very first time I did acne scars, it was a guy and he was getting married and he said, can you do these scars? And I was honest with him, and you want a practitioner who's honest. And I said, I've never done them before, would you like me to try? And he said yes. And the result was absolutely amazing. The result is the one on the website, so do have a look. Absolutely amazing. And from there I started thinking about it, and I've now given lectures and written articles about acne scars. So, you know, you want someone who's honest with you. You don't want someone saying, oh, I've done 100 of those when they've never done it before, because you need to go on the journey together. You need to know what you're both letting yourself in for. So I hope you found that useful. Please do ask me any questions you want, and come back next week for the next part of the series. Take care. Bye.